Welcome to AETCM, the Emergency Medicine channel. So today in this video, we are going to discuss about the parts of endotracheal tube. So ET tube or endotracheal tube, as we know, is a very crucial medical device which is used to maintain or open the airway or keep a definite airway, and then it is made of medical graded materials like PVC or silicone. So coming to the parts of ET tube, so as we know, it comes in different sizes. Now I have chosen a tube of 8.5 size. So as the size increases, like for adult females, the most common size that we use is 7 to 7.5. So for adult males, it is 8 to 8.5 that we commonly use. So as the size increases, what is increasing is the internal diameter. So coming to the parts, so here you can see the blue color, which is the adapter or connector, which is in the proximal end of the tube. So it is connected to the ventilator tubings. And then coming to the main part, also known as the outer cannula or the tube line, and so here we can see the markings in black color. So it is known as the depth markings. So it will ensure or it will guide the doctor on how far the ET tube has been inserted. So it ensures us or gives us a view about if it is too deep or too shallow. So these are the depth markings that you can see, and in the tube you can see a blue line which is running along from the proximal to the distant side, that is the radio-opaque line. So after the ET tube insertion, when we are taking a chest x-ray or a radiological imaging, in order to view the ET tube, if it is in place or not, the radio-opaque line is mandatory so that we can visualize the positioning of ET tube properly. So that is this blue line that you can see. And in the proximal side, we have one more thing, that is the pilot balloon. So the pilot balloon, it helps in inflating. So it is a thin tube, it is connected to the cuff that is in the distal end. So pilot balloon ensures the inflation. It helps in there is a port here, there is a valve here, and it is through this port of pilot balloon that we inflate the cuff which is in the distal side. So we will be discussing about the cuff afterwards. So now regarding the pilot balloon, so as I told, it's a thin flexible tube. So here it is connected, and the line is going inside through the tube and it reaches into the cuff. So it is connected to the cuff here. So it is basically used in inflating the cuff. And also if we wanted to check the pressure of the cuff, because the cuff should not be too much inflated, like the pressure should not be too much, because if there is too much cuff pressure, as we know that the airway, the tissues in the airway will get too much compressed, and that can lead to further complications. So we have to maintain an adequate pressure, that is between 20 to 30 centimeters of water. So that much pressure is only required for the cuff to get inflated. That is how we have to maintain. So if it is more, it will be difficult, it will lead to complications. So in order to check that pressure, we can attach the device into this pilot balloon and check for the cuff pressure. And coming to the distal part of the tube, so the thick black line, what you can see here is the vocal cord guide. So this has to be inside, this has to be inserted into the vocal cord, into the airway. So the physician has to make sure that that part has been inserted into the airway. And following that, we have the cuff. So as I told, the cuff is made of a soft material. So it is the function or the main principle behind this cuff is the first thing is to maintain the tube in position. So once when it is inflated, we have to make sure that the tube is in place. So in order to make sure that the tube is in place, the cuff will be inflated, and this will also help in preventing the aspiration. So no other contents will be moved into the airway. So this will be blocking the butt. The tube will be completely open, and this part will be fixed in the airway. And the next, in the very distal end, here you can see a hole. You can see two holes here. So the one which is not in the tip is the Murphy's eye. What you can see here is the Murphy's eye. So the use of the Murphy's eye is that, so here you can see the slanted end, that is known as the bevel. So if bevel is blocked, blocked by secretions or if there is any obstruction to the bevel, so we wanted to give ventilation for the patient. The ventilation has to happen appropriately. So if this is blocked, as an alternative for the air to pass, we have this Murphy's eye. So it is used as an alternative. If the bevel is kinked or if the bevel is obstructed with secretions, it is through Murphy's eye that the ventilation will be carried out. And this tube, it is made of, it is having a very softer outer covering which will not cause any irritation to the airway. So it is designed in such a way. So I'll summarize it again. So in the proximal in the proximal end, we have this connector or the adapter which will be connected to the ventilator tubings. Then you have the tubing made of PVC or silicone, and in that we have the depth markings, and then you have the blue line which is the radio opaque line, and then you have the pilot balloon which is primarily used in inflating the cuff which is in the distal end of the tube. And also in order to check there is a valve over here, so in order to check the pressure of the cuff, we can attach the device over on this pilot balloon and check for the pressure. And then you can see something over here as 8.5 ID. So ID stands for internal diameter. So as I told before, as the size increases, what is increasing is the internal diameter. And the black thick marking, what you can see here is the vocal cord guide. Then you have the cuff part, the Murphy's eye and the bevel. Thank you for watching.